Welcome everyone to the League of Women Voters special event on hunger. Hunger as a health issue. I'm pleased to welcome Linda Strohl to our gathering this afternoon, and I'm excited to hear from her about the challenges she experiences in her capacity as Executive Director of Senior Nutrition Services, Meals on Wheels of Southwest Michigan. It is there that she sees on a daily basis the many faces of seniors struggling with hunger as a health issue. Linda has enjoyed a fulfilling and colorful career. Her career began in the business community, working as a stockbroker and a financial planner. She then moved on, handling the business affairs of famous entertainment persons, which, if you can believe, led her to the nonprofit arena. Throughout her professional life, Linda has been a guiding force on behalf of seniors throughout the state of Michigan. She serves on the Michigan Commission on Services to the Aging and on the board of the Berrien County Health Department. She devotes her free time to various nonprofit and civic activities. And to name a few, the Chickiming Open Lands, Michigan Humane Society, and the breast cancer support groups. What makes her so good at her job is the diversity of interests that she has. She's a voracious reader, she practices yoga, and she loves spending time with her rescue dog, Baldwin. What a woman, and how lucky we are to have Linda, who has agreed to talk with us and to share her wisdom about hunger as a health issue. Linda Strohl.
I'm a bit of a wanderer, so we'll see how this goes with the video. Thank you for coming. Thank you to the League for being interested, and to Marilyn and Judy for contacting me about this. I'm going to talk about hunger as a health issue, but segue into senior hunger, since that's what I know the most about. I know that there are some of you here who have had first-hand experience with seniors in their homes and with health care. Hunger as a health issue is starting to be a sort of a buzzword in the healthcare field. Healthcare costs related to hunger are estimated to be as high as $13 billion a year. Yet for every dollar spent on food for someone who is hungry or food insecure, not knowing where their next meal will come from, can save $50 in Medicaid costs. It's a pretty good value equation. Approximately 20% of households with children reported that they experience food insecurity. Almost 9% of seniors experience food insecurity or hunger. And the health issues that come from that can include obesity, ironically, diabetes, depression and anxiety, behavior problems, fatigue, poor performance, and poor academic attendance. Children experiencing high levels of hunger have higher levels of chronic illness and internalizing behavior problems. My late husband, when he was in second grade, was held back. He was in foster care. After a career in financial services, he started running a food bank. And when he was in his 40s, he realized that as a child in the foster care system, he hadn't been given enough to eat. And they thought he was retarded because he wasn't learning. Never occurred to him before until he started hearing about hunger and its effect on children. I think the foster care family changed. There were other issues that occurred later, but when he started getting more food, his academic performance picked up. So, you know, we have the situation of hunger and what's being done. And what has happened is that food has been, and hunger has been kind of segmented into age brackets. And so for children, you've got WIC, you've got SNAP benefits that affect the family, that benefit the family. You've got school lunches. There are new programs that provide snacks in counselors' offices if they think the child is hungry. And the Blessings in a Backpack programs and summer meal programs. So there's an array of programs that are having some impact, but more still needs to be done. More than 13 million children in America still suffer from hunger and food insecurity. Families can access WIC for small children and mothers, SNAP, food pantries, soup kitchens, USDA commodity distribution, and mobile food trucks. For example, in Harbor Country alone, there are 24 mobile food trucks a year, one every 2 weeks, that are supported by various different organizations. And yet, hunger and food insecurity continues to be an issue. Seniors can access SNAP benefits, but I can tell you that most of the seniors that we know who get SNAP benefits get very, very little, maybe $100 a month. There's USDA commodities that are given out at senior centers. There are food pantries and food trucks if they can get there and if they can cook the food once they have it. Meals on Wheels programs and meals that we provide at senior centers. I participate in a number of anti-hunger groups, and I believe that we need to look at hunger as a spectrum. Because being hungry in the womb contributes to issues later in life. For example, if you don't know where your next meal is going to come from, you may overeat at the current meal. But if your food insecurity disappears, that behavior may not change. My mother used to tell the story about my brother, who was born in 1949. At that point, Dr. Spock was sort of the authority, and he said that you should feed children on a schedule, not when they were hungry. And so she did, and she felt that my brother, as a baby, was hungry. He continues, as a doctor, when he sits down to a meal, he continues to eat almost as if he doesn't think he's going to get another meal. Now, he's not grossly obese, but it's a real struggle for him to take off the extra 15 or 20 pounds that he needs to take off. And this is not someone who grew up in a poor family. This was the prevailing wisdom for children at the time. And I recently, because of my position on the Commission on Services to the Aging, got some interesting statistics on seniors in Region 4, Area Agency on Aging Region 4, which covers Berrien, Cass, and Van Buren counties. 25% of the population is over 60. That's an increase of 17% over 2010. 19% of seniors were below poverty in 2016. The number of people at or under 150% of poverty increased 13% from 2010. In 2017, Meals on Wheels of Southwest Michigan provided 635 homebound seniors with 98,791 meals in the homebound meal program. We deliver meals from the Indiana border up to Kalamazoo, from the lake to Niles. We also provided 1,474 seniors with meals at senior centers and community sites in Berrien, Cass, and Van Buren counties. Those are for seniors who are able to be active and out and about. And many people believe that the senior centers provide those meals themselves. They don't. We provide those meals. The senior centers provide the space, and we provide the staff and the meals. We also provide meals for 2 My Choice waiver programs for PACE of Southwest Michigan, and, this may surprise you, for 4 Head Start programs for toddlers. Because we've discovered that a meal for an adult will feed 2 toddlers according to the nutritional requirements that they need. One misconception about Meals on Wheels programs is that it is only for poor people. That's not true. 54% of our clients are under the federal poverty guideline, but that means that 46% are not. We are a needs-based program, not a means-based program. So anyone of any income can get meals as long as they're homebound, not able to shop or cook for themselves, and don't have anyone else to help do that. We have retired doctors, we have retired nurses, we have teachers, we have factory workers, we have waitresses. Anyone who needs a meal, who's homebound, who's over 60, we can provide meals. We do not charge for our meals. We ask for a donation. 35% of our homebound meal clients give us a donation towards their meal. 70% of our congregate meal clients do. And now I'm going to sort of segue into what I know best, which is senior meals. What do Meals on Wheels do? We provide 5 hot meals during the week. We can provide frozen meals for the weekend. We can provide what's known as a supper stack. That's more or less a lunch that people can eat either for lunch or for dinner. We do meals for holidays. We do emergency meals so that, as has happened a lot this year, if we're closed because the weather is so bad, people have something in their house to eat. We know that a majority of our clients rely on us for the majority of their food. Our hot meal is supposed to provide 1/3 of the daily nutritional requirement for our seniors. We know that for most of them it's 2/3. Most of our clients, whether it's at the senior center or at home, don't cook. Many, they can't cook. You don't want them cooking because, I mean, this doesn't go out of the room, but sometimes I put eggs on the stove and walk away. So for many of our clients, if you walk in the house, the knobs have been taken from the stove so that they can't cook. We had a young man call us, he was in his 50s, I think, who called and said, "Thank you for delivering meals to my mother." He said, she still thinks, she's 94, and she still thinks she can cook. But the last time she cooked, she almost burned the entire apartment building down, so that we took the stove out. My sort of slant on Meals on Wheels programs is that we're the nutritional support for the healthcare system in the community. We have to meet some fairly stringent requirements on what the meals contain in terms of protein, fat, sugar, salt. We have to do protein and 2 vegetables, fruit, milk, bread, and butter. And so we know what is in every meal, and our clients know what is in every meal. And so it has helped a number of diabetics, for example, get control over their sugar, and we have leveled the carbs at 85 carbs in each meal, which may be high, but our diabetics know that maybe they won't eat the bread today. And at least they know. The diabetic educators can work with those meals to educate their clients on what they can and can't do. But we also do more than meals, and we provide liquid meals. We do Boost and we do Ensure for people who need that additional help or who can no longer eat solid food. Often we are there before hospice, and we're there, we see hospice workers come and go as our meal delivery drivers are there. We see home health care nurses come and go. But we also provide more than a meal. The meal's the reason we go in the house. But I think if you really sat down and asked our clients what would happen if they didn't get meals, I think many would say that they miss their driver more than anything else. It's what I call the senior meal trifecta. It's the meal, it's the daily social contact with, as Renee, who just went out on some drive-alongs knows, bringing in the newspaper, taking out the mail, taking out the trash, saying hello, chatting for a while, and making sure that the client is okay. So who, in fact, actually gets the meals? I'm kind of a statistic geek. So 45% are over 85, and that is growing. 88% are Caucasian, 10% are African American, which pretty much mirrors the demographics of the county. 54% meet the federal poverty guidelines. 66% are women. 44% are widowed. And the need is rising. As Renee, not from, Renee likes to call it the silver tsunami. She's a new staff member. But from the seniors who are 85 and older, because people are living longer. And we have an amazing number of people in their 90s still living independently and getting meals from us. Our meals were up 3% last year in business. That's a good thing. In our work, not necessarily so much of a good thing. So the question then becomes, so why do meals? Why should there be a federal program that helps seniors get meals? And so let me ask you a question. How many of you would prefer moving into an institutional setting versus living in your own home? We help our seniors remain living where they want to live, as long as they can. And last year, we had a 38% mortality rate, which seems high. But the good news on all of that is our seniors were able to stay in their home, in many cases, right up to the very end, which is what they really wanted to do. But there are also there are economic reasons, there are moral reasons. Strong, healthy communities take care of the people who are vulnerable, the children, the disabled, and the seniors. These meals help decrease healthcare costs. They're not paid for through Medicare or Medicaid in most situations, although in the My Choice Health program, those are for dual eligible Medicare and Medicaid. And so we do get reimbursed for those meals. But you've got a meal for $5.25 a day versus home health aid to come in and cook for 2 hours at $50 versus the cost of a nursing home at $185. Now, I am not dissing nursing homes or home health care. I'm not at all. But there are places and times for each of those. And sometimes the meals work, and sometimes the meals work in conjunction with a home health nurse or a home health aide. So we all work together to make sure our seniors are taken care of. But do the meals work? So this is, we assess our clients at 6-month intervals, and this is what they tell us. 71% of our clients had improved nutrition scores on their nutritional risk assessment. 98% tell us that they don't always have enough money to pay for food. 2% reported that since they don't have to pay for food and they make a donation, they have more money. 92% of our clients report that they eat alone most of the time. And 2% said that their weight had improved. Now, we don't know whether that meant that they put on weight or they lost weight. But if you go into their homes, the majority of our clients are tiny. They're very small, and they're working very hard to keep weight on. And so how do our clients feel about our meals? Now, you know, I don't know how you felt about this meal today, but every week, our congregate meal site managers give us feedback on how the meals are. And every week, one site will say, oh, that meal was absolutely fabulous. Do it again. And another site will say, don't ever serve us that dog meat again. We won't have anybody at the site. And particularly when we serve liver and onions. Either people love it or they hate it. And one of the things we know for our home-delivered meals clients is they've given up cooking. How many of you have your own spaghetti sauce or chili recipe? Well, we don't make it that way. And therefore, they don't like it as much. But 99% in our survey ranked staff and volunteers as good or excellent. 97% rated the delivery quality as good or excellent. 88% ranked the quality of food as good or excellent. And 83% ranked the variety of food as good or excellent. And so we also ask questions. We asked questions based on a study that Meals on Wheels America had Brown University do. And we asked, do you think these meals helped you to feel better? 91% said yes. Do you think these meals helped improve your health? 88% said yes. Do you think these meals reduced work or worry for your family? 93% said yes. Do you think these meals make you feel less lonely? 87% said yes. And on these surveys, and I don't think our drivers pay them to do it, but we get remarks like, Jerry is the best driver ever, or give so-and-so a raise because he deserves it. And our seniors, our drivers, call them their seniors. So don't think that they're just seniors. Our clients all belong to a driver, whether it's a staff driver or a volunteer driver. And the beauty of our drivers feeling that way is that they really get to know our clients. And they get to know their habits. And they get to know that Mrs. Smith always comes to the door. And so when she doesn't, there's something up. And what we do is we first call the house and then call an emergency contact. In one case, we had a driver who knew the lady's habits very well. It was a Monday morning. She didn't come to the door. She didn't answer her phone. So he walked around the house. And as he walked around the house, he saw her sitting in her bed, waving at him. And so she motioned for him to come in the back door, and he went in the back door. And he realized that one side of her face was drooping. She couldn't speak, so she couldn't answer the phone. She'd had a stroke over the weekend and couldn't call for help. And he was able to get health care for her. We're there, in many cases, 5 days a week. And so we're kind of on the front end, the front eyes, the eyes and ears on the front line for health care. Because we can call the nurse, we can call the agency, we can call Area Agency on Aging, we can call the family and say, you know, something's wrong here. So how do you get meals? We get referrals from all kinds of people. Some people call themselves in, others family members. Sometimes that's tricky because the daughter says mom needs meals, and the mom says, I don't want meals. We get referrals from health professionals and all kinds of other organizations. But one of the things about Meals on Wheels is that it differs by program by program, and state by state. In Indiana, for example, the Meals on Wheels programs are run through the community action agencies. In Michigan, there are more than 16 programs, some of which are freestanding nonprofits, some of which are for-profit, some of which are part of an area agency on aging or council on aging. There's a small meals program called the Meals on Wheels of Niles Buchanan Meals on Wheels that delivers meals only to the Niles Buchanan area. The meals are made in the hospital, I think it's I don't know how many clients they have. I think it's fairly small. But when we have a waiting list, or if we have someone who's under 60, we refer to them. They don't receive state and federal funding, so their program is a little bit different. They don't have to, comply with all these meals regulations. And they do charge for a meal. I believe that there are scholarships for meals, but I'm not certain. So it's a very different program, and that's one of the things that's really confusing, because someone will say, well, I knew about a program somewhere else and they did this and this and this, and we're different. And so now we get into the sort of the who pays and perhaps why it's important to vote. We get federal funding through what is known as the Older Americans Act Senior Nutrition Funding. That was part of the War on Poverty that was initiated under President Johnson. That funding is earmarked funding. It flows through the state, which in Michigan is the aging. Hold on, aging. It's not ASA anymore. It's ASA. It's Aging and Adult Services Agency. It used to be OSA, and now they changed the name to the 16 area agencies on aging throughout the state. And state funding is administered by the Aging and Adult Services Agency that was recently folded into the Michigan Department of Health and Human Services. It used to be a cabinet level position at the state, and it is now no longer. So funding for our meals, for our congregate meals, is 99% federal. We get very little money from the state for the congregate meals. So if federal funding were to go away, we would probably have to cut meals at all the senior centers in the Tri-County area. Conversely, the home delivered meals funding, 33% is from the feds, and the rest comes from the state. We get no money from the senior millages that townships and the counties receive. That goes to the senior centers and to Area Agency on Aging. And even with this funding, which the Older Americans Act is authorized through 2019, so we've got one more year, it can be funded without the Older Americans Act being authorized. And it was, frankly, for a number of years under the past administration. But we don't know how that will operate under this administration. But with this funding, we still have to raise it covers 60% of the cost of a homebound meal and 70% of the cost of a congregate meal. So we still have to do quite a bit of fundraising. I often have ballet shoes on because I have to dance a lot for funds. The president's budget, both last year and this year, had zero amounts for the community development block grant funds and community services block grant funds. Many Meals on Wheels programs across the country get that. We do not. It also zeroed out community action agencies, which have a whole host of programs, many of which actually benefit seniors. In Indiana, as I mentioned, the Meals on Wheels programs are administered by the community action agencies. So if that funding goes to zero, it's unclear what would happen to the Meals on Wheels programs in Indiana. I remain optimistic. We've got a very good bipartisan support for the Meals on Wheels programs. I think that the cost values, the cost benefit argument has been made pretty clearly on both sides of the aisle. But it's a new administration, and we just don't know. Changes to Medicaid and Medicare would impact Meals on Wheels programs, as well as many other services. So how do we get these services out? We have staff members, because we've got such a huge area, and I'm about to wind up here. We've got 10 staff drivers who deliver both congregate and homebound meals to the senior centers, and volunteers pick them up from there. Some of the senior centers deliver the meals for us. Some of the senior centers, some of them don't, and our staff drivers take them out. For example, in St. Joe and Benton Harbor, we have staff drivers. In Niles, we have a staff driver. In River Valley, we deliver the meals, and volunteers pick them up from there. 80% of the Meals on Wheels of Southwest Michigan staff is 60 or older. And so we really are committed to, well, you're such a youngster. She brought the age down by about 10 years. So we give them opportunities to remain committed and involved and engaged. And we are, I think, the largest employer of people over 60 in our area. But what happens if there are no Meals on Wheels programs? Our clients, our homebound meals clients, can't access the other Meals on Wheels, the other anti-hunger programs. They can't get to a mobile food truck. They can't lift the food, and they can't prepare it when they get home. They can't get out to go to food pantries or senior centers. And so if a Meals on Wheels programs go away, not just locally but across the nation, then what you see is an increase in the number of people who don't really need nursing home level of care, but who are in nursing homes because they have no options. They have no alternatives. So the Meals on Wheels programs give people the ability to remain living in their home with some social contact. We believe it improves their quality of life rather than being alone. And the drivers become their friends. We recently, yesterday, one of the drivers called in and said that someone that we had as a long-time client, he thought she had died. And Alice, who's our wonderful kind of dispatch person, became very upset because she's known her, we've all known her for years. She calls us up sometimes and just talks to us about interesting questions because she really doesn't have anyone else to talk to. And Alice called the hospital, and no, she hadn't died. She was being worked on, but she hadn't died. So we all they become friends. And our drivers have a really tough job sometimes because they see their friends go away. But they're wonderful people. And I think it's a good program. I think it does a lot on a lot of different levels for really very little money. Thank you. And I did go on longer, but.
Thank you very much, Linda. She brings me back to my very first days as a visiting nurse. And if I look back in my career, I say that was the best job. And really, we use Meals on Wheels all the time. So everything that you said is so true. But now just a little homework, because I'm sure many of you have questions, just as I do. What we'd like to do is, for about 10 minutes, just have a question and answer period. And then Linda has agreed afterwards, if any of you still have questions, she'd be delighted to answer them for you. So, who would like to begin? Yes, Dorothy.
Okay, what would your call to action be for us?
The call to action.
What can we do to help promote with our legislators and?
I think.
Excuse me, just for a minute. Because we're taping this, could you kindly repeat the question? All right, thank you.
Dorothy asked what the call to action is, and what the League can do to help. I think advocating on behalf of the senior programs, including Meals on Wheels programs, but Medicare, Medicaid, and meals would be very helpful. And I've got all kinds of stuff that I can give you to be able to do this, statistics and so on. Some of these statistics I prepared when they were talking about cutting Meals on Wheels programs.
Anyone else? Yes, Chris.
Where are the meals actually prepared?
Well, the congregate meals, where are they prepared? The congregate meals are actually prepared by the people who did the meal today at CK Catering in Benton Harbor. The homebound meals are prepared at JA Food Service, also in Benton Harbor. We really believe in supporting local companies.
Anyone else? I have a question.
I'll ask another question.
Sure.
Would it not help for us to contact our representatives supporting?
Sure, absolutely, absolutely, absolutely. I will tell you that the state of Michigan has declared that they want to be what they call a no-wait state for senior services, and they are putting money towards that. But making sure that elected officials know, whether it's state or federal, and the incumbent, or the people who are running in the primaries, that they understand the importance of senior programs. Unfortunately, it feels as if, let's say senior programs, and actually in some cases child programs, are not at the forefront at the moment in social services. But we'll see how that comes out of the budget. It's still a work in progress.
Yes, ma'am.
I just had a question on the funding.
Sure.
I took notes and I
Sure.
didn't read
Sure.
my notes.
Sure.
But did you say 3% of the money comes from federal funding? 3%?
Did I say that 3% of
funding is
no? Let's see. Hold on. Let me back up.
The question for everyone was whether or not 3% of the funding.
yeah.
No, actually, I think I said 33%. 33%. Yeah, 33%.
Yes.
How would the president's food box program that he proposed work? And would that be helpful or not?
What the question is, what would the president's food box? How would that work, and what would the impact be? My understanding, let me see. My understanding is that it would be somewhat like a Blue Apron, or one of the meal delivery services, with some significant differences. And one is that I don't think you would be able to choose your meal. I think it would be similar to the commodities giveaway, which is primarily cheese and cereal. There wouldn't be fresh fruits or vegetables in it. there are a number of concerns about people with special diets and people with allergies and how that would be handled. My sense is that, that there will be some changes to the SNAP program, but I'm not sure that it will go as far as a food box.
Yes,
So
Deb.
you actually prepare food with in mind having the food allergy?
In order to be in our program, the question is, do we prepare food with food allergies in mind? Yes and no. People need to be able to eat a fairly general diet in order to be able to get our meals. We aren't, for example, able to do gluten-free, because gluten-free, if you have celiac disease, has to be prepared in a separate kitchen, and it is prohibitively expensive to be able to do that. The kitchen would have to build a whole nother kitchen with their own pots and pans, and so it's very difficult. We can do diabetic, we can do vegetarian, we can do mechanical, but we're not a restaurant, and so when we're doing 250 meals home delivered and 250 meals for congregate a day, we really can't tailor it to that point. We wish we could, but at this point we're not able to.
Well, I have a question. I don't know how any of you felt about it, but when you were describing the client that you had who was having a stroke, that same thing happened to my son. And throughout your whole conversation, I kept thinking about all these young folks who have strokes, who are disabled, who could truly benefit from a program like that, and not only from the food, but also, as you said, from the companionship, if only for 5 or 10 minutes. And it's solely lacking in not only the state of Michigan, but probably throughout the United States. Is there anything on the forefront about that?
It's going to be a hard question to repeat.
Okay. Is that all right, John?
I have advocated at the state level, and I have advocated locally to create some sort of a fund for example, disabled veterans who are not 60. And I think that could be extended to disabled Medicaid recipients. At this point, there doesn't seem to be an appetite to do that. We can provide meals to people who are under 60, but we have to charge for them. And it's $5.25 a meal, which is really, well, but for many people on disability, that's an awful lot of money. And so we're really hamstrung because we don't have, there's no funding to do that. Insurance companies are starting to pay for meals in a very small way. Aetna is doing it. Meridian is starting to do it. Some of the other ones are starting to do it because of this whole recognition that hunger is a healthcare issue. But that's kind of slow out of the box at the moment. It's a dilemma. There's no question. When I asked what the process was for a disabled veteran who was under 60, the response was, well, we refer them to DHS and the food bank, and which is certainly fine. But if someone really is profoundly disabled, it may not go far enough. So, yeah, it's a need. There's no question there's a need. And I've been trying to raise that up the flagpole, but it hasn't happened yet.
Well, you've taken on so many issues, has she not? Yes. And we certainly have enjoyed having you, and we hope
Thank
you'll
you.
stay for
Thank you.
anyone
Of course.
Who perhaps was shy to ask a question. So thank you
Okay.
very much.
Thank you. Thank you.